right, so we're going to go ahead and start. There are a few people rustling up the last of the food. But we're going to start because we have a lot of things to cover tonight. Let's see. First of all, did everybody who is interested get an opportunity to put their name and email in the hat for the drawing for a scholarship, $500 scholarship for global public health trip this coming summer? We'll do the drawing at the end so that you have a chance to really anticipate. All right. So anyway, if you have it, raise your hand. I'll get you a little piece of paper, fill it out, name, email, and then we'll draw out for a winner of the scholarship tonight at the end of the meeting. First of all, thank you for coming tonight. This has become a tradition. The first in January to have an information night where people that are interested, people that have been in the past, are able to answer some questions about learning abroad opportunities that we offer in the summer. We have a variety of individuals that are going to present on a number of topics about where they went, and we're going to touch on the various opportunities that we will be offering over the next year. So, my name is Scott Benson. I'm a faculty member here in the Division of Public Health. I'm the director of the Office of Global Public Health. I'm an infectious disease physician by training, but I'm also an environmental engineer by training. So I kind of get to wear both hats, and I get to play in the playground of public health, global health, and in the realm of some clinical medicine things. So I get to really have a lot of fun, and so we'll talk about this. One of the things that I'm going to do is to begin talk about kind of our approach to global health and why I think our programs offer such a unique opportunity. Then we'll break into the different programs, and we'll let the people who have gone on the Armenia program talk a little bit about the Armenia program. We'll let Sharon talk about who's managed our India program, talk about India. You'll hear from Ty Dickerson and myself about our Ghana and Peru programs and some of the opportunities. But what I'd like to do is first start talking about what our approach has been over the years. So, we're a university. Our job as a university is to really do one thing. And it's kind of tied up into a couple of terms. But as part of the university, we have a number of educational activities that revolve around the mission of the university. Here within the Office of Global Public Health, these are some of the educational offerings that we have. We have a Global Public Health Grand Rounds, the second Tuesday night of every month in this room that you're all invited to at 5:30, where we have clinicians, lay people, individuals that operate, organize, work for, participate in global health activities have the opportunity to come, present their struggles, their successes, and then have a dialogue back and forth. We try to keep the group small enough that a conversation can be had, and yet large enough that there's a diversity of opinions and presentations. It is not just clinical medicine. It's a public health focus. We also offer both graduate and undergraduate coursework in global health. We, in the Division of Public Health, we offer almost 20 different courses, and if you look at the different sections, it actually goes up to about 40 different courses that involve global health work. We have our Global Health Learning Abroad that's actually mentioned twice, and I'll explain that in a minute. We have a Global Health Certificate for those that are in graduate school. So as an undergraduate, you have your major and your minor. Once you're a graduate student, you really don't have that kind of secondary emphasis, except for the certificate. We have a graduate school approved Global Health Certificate. So anybody that's in a graduate program can take a series of courses, including a learning abroad opportunity, and achieve a certificate that demonstrates proficiency in global health. We have the Global Health Scholars Program through the Honors College, where undergraduates that are interested in global health have the opportunity to study global health and to participate in our learning abroad activities. We have a number of presentations and posters. At last count, we had over 100 different presentations and posters at international conferences over the past 7 years. And we are up to, I think it's about 25 different publications from our global health enterprises in peer-reviewed journals over the past 5 years. Now, our learning abroad opportunities are what we're here to talk about tonight. And that's what we're really going to emphasize. But the background is this is all part of our educational opportunity here at the university because we incorporate it all into a single term. We call that term scholarship. Now, generally, people think about scholarship, and I've been mentioning scholarship at the beginning in terms of having somebody else pay for your schooling, having the opportunity to do something for a lower price. Actually, the term scholarship breaks down into the activities of the university. The university's job is scholarship. We are here to produce new knowledge. And our learning abroad opportunities are not just trips, but it's actually, we have the practice of generating new knowledge at each of our learning abroad sites. If you look at our research opportunities at our learning abroad sites, we look at health systems, we do community health needs assessments, we have micronutrient studies, we have environmental water and sanitation studies, we have social work, gender equity research going on. So within each learning abroad opportunity is the opportunity to become part of a research endeavor. If you're a medical student, this research endeavor can meet your research requirement, your scholarship requirement, if you work with us in advance so that we can make sure that we match your criteria. If, as an undergraduate program, you have a research requirement, give us the time we can work out so that you take a leadership role in the research program to meet research requirements. We can almost always meet the research requirements that you need. Our goal is to develop new knowledge in the arena of public health. But that's only one of the missions of the university. Our second mission is the reproduction of knowledge. That means teaching. We've generated new knowledge, it's published out there, but now how do we get that information into the class? It's taught, and apparently I'm missing a slide. I don't know where it went. The third aspect of scholarship is knowledge implementation. And this you could kind of call service. So there's the university's job to generate new knowledge, research. There's the university's job to reproduce known knowledge, education, teaching, and then there's the implementation part. And this is where we work with our communities to take that knowledge off the library shelf, out of the books, and put it into practice in the lives of students, community members, and the community to improve their health and their livelihood. The way we do that is through community engagement. In each of our settings, we are involved not just with the University of Utah and a community, but with the University of Utah and the local partner academic institution and the leadership from our communities, where our faculty and their faculty work together to help our students and their students learn how to implement solutions that the community needs. So, as an academic, I get that research credit, I get those publications, the things I can check off to advance my career, because that's the stuff you have to do. As a student, you get the opportunity for learning and for research. And as a community member, you get your health improved by using state-of-the-art, university-developed research programs. We've done community building, we've built toilet facilities by using educational models that are done here in the United States, applying them with local intervention and local application suggestions from the local community in Ghana. We have community health initiatives where we're building community health compounds, training community health workers to address some of the highest causes of childhood mortality in West Africa. And then we have water and sanitation campaigns. This is the model summarized. We collaborate with academia, with students, to improve the health of communities. In the past, this is just some of the comments that students have made. I'll let you read it. I won't bore you anymore. All right, should be done. So what I'm going to do is we're going to take the next few minutes and go through each of the programs. We really have, at present, 5 partner sites around the world. Armenia, China, Ghana, India, and Peru. Due to certain circumstances, our China program is not going to operate this season. So we're not going to talk much about China. In fact, we just talked about China. We're not taking students to China this year. We've had to put our research activities on hold for a number of reasons. But what I'd like to do first is then let's see, are you going to talk about who's the 2 of you? All right. So we have 2 of our students who were in Armenia last year. Dr. Herbsme Wright, who is Armenian, has established a program in Armenia and has been directing it now for almost 4 years, going on the 4th year. And so I'm going to invite the 2 students who were here who went to Armenia last year to come give a few minutes on Armenia. Let's see, I'm going to switch this. Yep, you can just use these. Cool. Sorry.
So my name is Valerie Tran. I am a second-year pharmacy student, and I went to Armenia last year with Dr. Wright. It was really successful. It was actually the largest program that she's taken. We had 22 students from all different majors and studies that came, including undergraduate students, graduate students, public health. I think we had poli-sci, we had nursing, we had pharmacy, we had pre-med, so we really covered the spectrum on it. This year's dates are going to be May 30th through June 19th, and then there will also be 3 weeks of pre-departure work right before that as well. So, just a little about Armenia. It is in Europe. It's next to Turkey, Georgia, Azerbaijan, and Iran. It's about the size of Maryland, so it's not super, super huge. And the population is about 3 million people, which is about the size of Los Angeles. About half of that population is going to be in Yerevan. So it gives us a really unique perspective because we got to travel all throughout the country. We went to 5 different sites to do outreach events, and you really get to see a lot of differences between the populations. So there's kind of, you can see itty bitty Armenia right here, and then Turkey, Georgia, Azerbaijan, and Iran. So a little bit about history. A lot of the pride of Armenia comes from the fact that it's established as the first Christian country. They have their own Armenian alphabet, which you can see here. And then they were also part of the Soviet Union. So that's also something that is really interesting about Armenia that you would get in this global health trip that you don't necessarily see in some of the other ones. It's interesting to walk into a place that seems like it's this pretty developed country. You know, a lot of times even when we got there, we looked at some of their malls looked like they would rival City Creek Center here. It had a Burberry, it had some Valentino stores. It was beautiful and fancy. But then you really think about this and you say, this doesn't really seem like people that necessarily need help. So do we really belong here? Should we really be doing global health? And once you start talking to the people and you really start digging a little bit deeper, you see below that surface, there actually are a lot of underlying health problems. A lot of the diseases are chronic. So we've got a lot of diabetes, a lot of hypertension. Smoking is hugely, hugely prevalent and underreported. Almost all of the men smoke, but the women smoke in secret, so they would never admit to it. So really smoking prevalence is probably in the 80s to 90%, but the reporting on it is going to be a lot less than that. So these were some of the different things that we tried to address when we went over there. We're going to talk a little bit more about the outreach portion, but first let's talk about the cultural exposure, which we got a lot of. It was a lot of hard work going there, but we definitely balanced out our fun with our work. So some of the things that we got to do were the food. Their ice cream is amazing. It is so good. And like something about the dairy over there, it just tastes amazing and phenomenal. And it's really, really cheap. It's like 50 cents. It is so good. So there's lots of pictures of ice cream. This right here is spaghetti ice cream, which sounds disgusting, but it was really good. It's like vanilla with like strawberry syrup and then, what was the Parmesan cheese? Oh, white chocolate. Yeah. White chocolate was the Parmesan cheese. Fantastic, just so you know. This guy over here was making shawarma, which was also super tasty. If you go over there, then you'll learn about lavash, which is kind of like a tortilla or like a flatbread, if you will. Also super good. The food was amazing. We ate a lot. We got to see a lot of temples, museums, monuments. It's really, really great to be able to see this culture, and whether you have a religious background or whether you don't, it's really cool to be able to be immersed in this environment and really get to see all of this history. It really is in that old Europe where there's just so much there. And we got to go on a bunch of tours, and Dr. Wright really does a great job of making sure that you get this well-rounded cultural experience while you're there. And of course, no trip is complete without a jumping photo, so there's ours. Local attractions, we last year and actually this year, the dates will coincide with Armenia has 2 different Independence Days. So we were there for one of them. That in the top left corner is the view of their Republican Square as they were doing their huge celebration. So there were fireworks, there was a concert, there was a like water fountain show and dancing. So that was really cool. Just a shout out to the pharmacy because there were a lot of pharmacy students on here. So that's an Armenian pharmacy. It is not pronounced Anteka, but that's how I pronounced it because I'm smart that way. And then there's some of the really cool local things that you get to learn as well. So this is a fun little thing that you'll get to do. It's a hole in a rock that's like this big, and if you climb through it X amount of times, then your wish is supposed to come true. So a bunch of different things that we got to do while we were there, but more on the project itself. So similar to what Dr. Benson was saying, the goals are we want to build capacity and bring about sustainable outcomes. So that means that not only are we going over there doing some research, but partnering with the medical students over there, partnering with their different organizations to really see how can we make our recommendations implementable and how can we make sure that these are going to be things that can be sustained over time. We really got out there to work in the community, so working with health professionals and seeing what do they know and then giving them learning aids that we had provided and that we had created for our patients as well. We worked as a multidisciplinary team, as I said before. We were with medical students, with global health, with all sorts of things that cover the spectrum. And then all of that culture and history that we learned about, then we applied that to make all of our recommendations. The academic experience, there's 3 weeks of pre-departure work, so that's where we did a lot of learning modules to learn about the history of Armenia. We learned about what are the different health crises that they've had in the past and what are some of the things that apply to it. And then we prepared the handouts and the presentations. And then once we were in country, we had 5 different outreach events and we worked on 5 different research studies, which for last year, that was the biggest course or workload that Dr. Wright has ever attempted. And we were very, very proud of ourselves to be able to successfully accomplish them. So some of the examples of the handouts, we created them, and then you can kind of see here, we had to, once we got them done, we had to then get them translated into Armenian. It's really cool. We also got the opportunity to learn how to work with interpreters while we were there, which has an art all in and of itself. So that was also something that was kind of cool. And then Diane is going to talk to you a little bit more about the work portion and then the after portion of the trip.
So I'm Diane. I also went last year to Armenia with these fine folks, and Brian sitting here. And I'm in my final semester of the nurse practitioner program here at the U, and I also finished the global health certificate, the graduate certificate in global health last August. So this was kind of the culmination of my certificate. But, so as Valerie was stating, we went on these 5 outreach events. You can see that we went kind of all over the country, down to this very rural, remote site, Goris, and then kind of up around Yerevan. We were staying mainly in Yerevan, the capital city. Also going out to Lake Saban and kind of up further north. We were in urban areas, kind of more suburban type areas, and then rural places. At these sites, we did outreach. You saw the handouts. We kind of set up these health fairs. It drew a lot of the local population into the clinic. And then we were able to conduct our research studies while at these outreach sites and also provide some education presentations. So we did 2 presentations for the Armenian public on cardiovascular and cholesterol, and then also on diabetes. and then one presentation for providers in the local sites about diabetes management. We had the opportunity to collaborate with a lot of different organizations. You can see this is Dr. Wright, our fearless leader, with the Armenian American Wellness Center, I believe. Yeah, Armenian American Wellness Center director. And you can see in this photo, I really like this rectangular photo because it shows all of us students as well as all the interpreters we had the opportunity to work with, the local clinic employees, and just a huge interdisciplinary team. The research we conducted, we did research on diabetes knowledge. We assessed knowledge of providers, medical students. We assessed providers in Georgia as well. We did research on immunization beliefs, also on health information sources and breast cancer, and future directions for research in cholesterol and thyroid. Some updates after returning from this program. So we've had some great opportunities based on this research that we've conducted, but at the Unite for Sight Global Health Innovation Conference, we will be giving 3 podium presentations in March on our diabetes research as well as the health information research. And then at the CUGH conference, we've had 3 posters accepted. And then also one update, we are currently hosting a breast cancer surgeon from Armenia here at the University of Utah. All right, so major highlights from our program. It's very multidisciplinary. I think that's one of the great things about this program. As Valerie said, students from all different colleges in the university, and then the opportunity to work with a lot of different people within Armenia. We focus on community-based participatory research and needs assessments, and then on building capacity and facilitating sustainable outcomes. And as you can see from our photos, we all just loved the experience. It was very rich, both culturally, academically, and professionally. For more information, this is the program director, Kritsumi Wright, as well as some links to the Global Health Armenia website and the Learning Abroad office.
Great. We'll have time for questions after, but if there are any questions right now, please go ahead and ask, or we'll keep going, and you'll have time to speak with individuals as we finish.
Check
All right.
out globalhealtharmenia.org. There's a lot of good videos.
Yeah.
So, feel for what it was like.
Okay, so we're going to jump for 1 minute. We're going to jump continents. And we're going to talk a little bit about Ghana. So, Dr. Dickerson, where's Ty? Okay, Ty, feel free to chime in at any point and take whatever opportunities you want. Ghana was our initial program. We celebrated our 10-year anniversary in Ghana this past year with a big celebration that had various individuals from all the way from the federal government, the Ministry of Health, at the local level, the district health people, or to our community members. This year in Ghana, we'll be going back in July to the beginning of August. Now, at the end, remind me, because there's a special opportunity in Ghana this year that we haven't always had in the past. And I don't want to spoil the surprise, so when we wrap up Ghana, remind me, and I'll tell you about our special opportunity in Ghana this year. Just because we're all American and sometimes a little map-phobic, Ghana's in the West African region of Africa, hence the term West Africa. It has not been hit by Ebola. Okay? So at the moment, we are planning on going to Ghana. In fact, the last time I flew home from Ghana in October, I brought home 150 blood samples. Didn't get searched once. Now, I got evaluated for Ebola going into Ghana because I was coming from a country that had Ebola, the United States, into Ghana. But coming home, never checked. Anyway, you can see the population of Ghana is about 11 million people. About 2 million of them live in the Kumasi surrounding areas, and that's really where we work. We've been here for 10 years. We're paired up with the Kwame Nkrumah University of Science and Technologies, where they have a medical school, and they're developing a school of public health. with the Companoche Teaching Hospital, which is the tertiary care hospital that is the second largest hospital and really has the catchment basin of all of Central and North Africa, Ghana. And with our community members that populate over 20,000 people in the BCCDP. In the past, we've looked at a number of issues, including childhood undernutrition. We've looked at infectious disease, schistosomiasis, diarrheal disease, hookworm. We've looked at growth stunting. We've looked at poison control. We've looked at toxicities, overdoses in the community. Every year we have a health education program. In Ghana, what we've been able to do is every year we meet with our community. And the first thing we do is ask for permission to come back. As they welcome us back in, we go community to community and present to them the information that we learned from the previous year, so that it doesn't end up on some shelf somewhere, that the information gets back to those local members of the community who allowed us to work with them the years previous. So one of our programs is always evidence-based health dissemination and promotion of giving the information garnered from our previous studies back to the communities in a method that they can understand. We've had water and sanitation, hygiene programs that will likely be continuing. In the past couple of years, we've had some very successful programs. We've really shown what was previously not described, that almost 50% of adults in rural Kumasi, in this area of West Africa, have undiagnosed and untreated high blood pressure, called a silent epidemic. These individuals are at risk for blindness, kidney failure, strokes, to name just a few. All of this is treatable with simple, readily available, government-provided medication. And yet it had never been even measured. So we were invited to be part of a global surveillance system monitoring non-communicable diseases such as high blood pressure. So every year we now have a group that surveils the community, goes out identifying new cases of high blood pressure. We're perhaps expanding that this year into diabetes and cholesterol, getting them into appropriate local care. We don't provide any care. We're not care providers. We are not licensed in Ghana. We work with our Ghanaian counterparts so that the community has confidence in their providers to provide them the appropriate level of care. So we have community health worker training. This year we're launching our integrated management of childhood illness program. We'll be training approximately 30 community health workers to work in our catchment area of 20,000 people. This is the first of 200 to be trained. They'll be given bikes, they'll be given equipment to treat, to identify and treat childhood pneumonia, diarrhea, malaria, and malnutrition in the patient's home prior to their activating the healthcare system. And then if they need to activate the healthcare system, being able to refer them to the appropriate medical care facility in their area. We're starting the training program this summer. And then we'll have continue with the water and sanitation evaluation program. Latrines, clean drinking water. Ty, anything else you want to add to the list?
No.
Okay. Now, one of the keys to Ghana is we always have about 20 students coming from the United States, plus or minus. But we usually pair up with 40 to 60 Ghanaian students. We're invited into the individual's home. Our research takes place in the community, in the population's house. So you get to see what real Ghanaian life is like. Allison, what'd you see?
Well, they really cared about what you sat on. So, like, for instance, on this right picture, they're all sitting on benches, and the guys would give me their benches if there weren't enough, and they were always cleaned off, and they wouldn't let me hold my things, and they wouldn't let me sit on the ground, and nothing was allowed to touch the dirt.
So you get to see a side of Ghanaian life that normally you wouldn't get to see.
Yeah.
All right. But we work with our counterparts because sometimes we need them to interpret into Twi, the local language. Now, while Ghana was a former English settlement, the majority of things happen in English. But every once in a while, out in the communities, you need translators to local dialects. And so we do. And it's also fun to learn just a little bit of Twi, enough to get around. So typically, we meet up with our Ghanaian counterparts, we go out into the communities, we break up into small teams, we go house to house doing our project, meet back in the afternoon, come back, decompress, and do it all over again. In a typical day, we start probably 7 a.m., finish up 6, 7 o'clock at night. It's warm. We have a lot of good projects. This is Schistosomiasis pond. We've been looking at treating schistosomiasis, coming up with new novel ways so that people can continue to socialize in their environment and yet not risk themselves nor their kids with schistosomiasis. We always meet with the chief and the community elders to make sure that we have permission to come back into their communities and to ask permission to leave every year. This was the toilet at the school and responsible for some of the little girls dropping out of school because it's embarrassing to drop trowel in front of the boys to go to the bathroom. We now have a water and sanitation system, 10 potties, no waiting, 4 sinks, inaugurated by the chief. But I do admit, while it's good 10 days of good hard work, we do have a lot of fun. We travel with our Ghanaian counterparts in areas. We have to the Sacred Lake, have a party of volleyball, soccer, hopefully not swimming unless you want Schisto. Food fun. We travel to Cape Coast where we see the remnants of the slave castles where the slave trade came out of West Africa for some of the more sobering moments of the trip. And then a trip up to Mole National Park to go chase the elephants and get chased by the elephants. This is Larabanga. It's the oldest mosque in West Africa. We get a chance to stop by there as well. And then our group, this is a couple years ago, but our group of Ghanaian and American students. The red shirt now is recognized that when they see the red shirt coming, they know the University of Utah is back. They know exactly who you are and what you've come to do, and they welcome you with open arms because we have the 10-year successful track record of working together. We're calling it a different way to make a difference. So if you're interested, come with us to Ghana. Happy to take you. Doesn't matter your discipline, we work with everybody. You can contact either Dr. Dickerson or myself for learning abroad. We'll all get you squared away and plugged in. Okay, that's Ghana. Questions?
What are the dates?
The dates are July 11th to August 1st, if I remember it correctly. Now, because Ghana is in Africa, special announcement, this year we're going to come home through Paris. So we're offering a 5-day stop in Paris to look at public health successes in Paris as they relate to the Eiffel Tower, Notre Dame, and the Louvre. Okay? So, if you're interested in going to Ghana and coming to Paris, talk to us, and we're putting together a special second program for those that have the time and the interest in coming home and spending a week in Paris.
The dates for all 4 trips are posted on our website.
The dates for all the trips are posted on the website in case you
After
need your
August
grant.
1st, right?
Right, that's after the main date. So we have in-country dates for the 4 countries, not yet posted for Paris.
Yes, we have not added Paris part. All right. Question. Sharon, come up and talk about India. So this is Sharon Talboys, who worked in our India program for a number of years, and I'm going to turn the time over to Sharon.
Thank you. Now we are going to head to India. It's a wonderful trip. We will be leaving July 10th, coming back August 2nd. Oh, that's correct. So, first of all, my name's Sharon. I've been here with the division. Sometimes as a staff person, I've been helping lead co-lead this trip since 2011. This summer will be our 4th trip with students. And our faculty lead, Dr. T.P. Singh, my partner in crime on these trips, he is actually in India right now. And he's also public health faculty, but he's at the Korea campus. He and I would be working with you throughout the spring to develop your projects and go through orientation and the pre-trip planning that's involved. His lovely wife and also someone who's been with us on the trips and helping with these projects is Narutma Singh in the back. She's here for questions later as well. I'm going to talk about where we go. We stay in the city of Chandigarh, which is an urban area, but we work about an hour outside of Chandigarh daily doing field work in rural villages. And we also do excursions to the Himalayan foothills, to Dharamsala and McLeod-Ganj, which is home of the Dalai Lama, and you see Buddhist culture, and we also see Sikh temples, and we go to the Taj Mahal in Agra on the way home. And oftentimes have a chance to see Delhi, and one of the highlights of Delhi is the Delhi railway station and taking a train ride. So here's where we're located. It's in the northwest portion of India, bordering Pakistan. Actually, if it were 75 years ago, that little part of Punjab would actually extend way out here into Pakistan. It used to be one large Punjab. Now 2/3 of it is in Pakistan. This is a village scene. I kind of call them small urban villages because they're tightly compacted, because so much of the land is used for growing rice and other agricultural work. So even though they're rural villages, they're very compact. I love this trip, and I can tell you that Dr. Singh lives for this trip. He is a wonderful leader, and the hospitality of our partners in India is overwhelming. I want to invite you to this trip as an opportunity for you to be part of a diverse public health field team. It's an opportunity to practice global health in both a challenging yet a supportive environment. Like I said, the hospitality of our partners, as well as the mentoring you'll get before and during the trip, is a big part of what we do. You'll have a chance to build your research skills, potentially present your research, and possibly publish your research or your team's research after you get back. It's a chance to develop leadership skills and cultural competence. Oftentimes, in these team situations, there'll be plenty of opportunities to take on a leadership role. And it's also a chance to challenge your worldview. This can be very transformational and life-changing for many of our participants. It's a great experience. The reason it's so great is it's based on a strong collaboration with our partners. And this is where the diverse team comes into play. So we call ourselves the Basi Patana Community Collaborative Development Project. And we are partnered with a civil society organization. It's an Indian nonprofit charitable trust, the NBCT, and they have reached to 180 villages. Over the years, they've helped us connect and be invited and welcomed into 9 of those villages, and that's kind of our global health field lab, if you will, because we have 9 villages who welcome us, who know who we are, and tell us what they want us to focus on, and tell us about what their needs are. So we've been working on assessing their needs and working with them on community-driven solutions for the last 4 to 5 years. We're also partnered with a School of Public Health in India. It's the PGI, or the Postgraduate Institute of Medical Education and Research. This is one of the premier medical research institutions in India. It's funded, it's a public institution, just like the University of Utah, funded by the government of India. That we have some wonderful collaborators there. In fact, some of our projects are being they're taking, the projects we've started with, and they're running with them all year round. So it's not just a summertime 1 month fly in, fly out. Our partners are really wrapping around on these projects all year round. And then, of course, the Division of Public Health. The main topics, as a partnership, we've done some strategic plannings, and we have this great goal, an ennobling goal of empowering these communities to be sustainable villages, and through community-driven improvements. As a collaboration, looking at the collection of our skills as a team, we've done some planning work and prioritized these main topics as the kind of work we focus on. What's great about these topics is that they're pretty broad and multidisciplinary, but also have a big impact. Water, sanitation, hygiene, child malnutrition. We know that despite programs that are in place, children are still going undiagnosed and untreated for malnutrition, despite resources, so that's a quality improvement project. And we also are looking at harmful gender norms and trying to shift some of those norms in favor of human rights. So basically looking at social determinants of health. The field work you'll be able to participate in will really engage a variety of research skills. We do qualitative data collection, quantitative data collection. We've done some GPS spatial mapping in the past, especially with our sanitary survey with the environmental health piece. Most of the work we do has been oriented towards assessing community needs, but also processing the findings with community members to figure out what to do with that, where to go next as a collaboration. And we also cover a diverse range of topics. Environmental health, as you know, is a key discipline in public health. This has been an active project. This is a picture when we first went in. They said, oh, we have plenty of, the government came in and built all these improved pit latrines for us. But there's a big but. And then as they take us around to show them, this is one of those pit latrines. It's clearly out of use. Many of them were used as goat sheds or storage sheds. But the government came in and planted them without consulting the community. So either they're in inappropriate places or not convenient, or there's no means to clean them out. And as you may know, it's probably no fun to maintain a pit latrine when you don't have the tools to do so. So we've done some pretty broad-scale environmental health assessments, point of use drinking water assessments, lots of water samples. Here's one of our students and one of the field workers from the NGO taking a water sample the first year we went. We've also done some health education, health promotion. The results from the WASH assessment the first year, looking at the contaminated water and all that, led to implementing a WASH program where community youth were recruited and went through 14 days of training and became WASH promoters. So now every one of the 9 villages has 1 or 2 youth who are trained and out there doing WASH promotion with the posters and using health promotion methods to do so. And our students are leading the way. There's some of our students checking in on the WASH teams, having a community discussion about that. These 2 students were working on the WASH project 2 years ago, and this is the community's water and sanitation committee. And so they're talking about the results and what happened. And here we have a faculty member from PGI, who's the environmental scientist lead. So we really work as a team with the academic partners, the nonprofit, the community outreach organization, and the community members. And we've really gotten to know the structure in the villages in terms of how committees work, what committees are established, what's on paper, what's for real, what are the politics in the community, and how do you unlock some of the resources that are already there, how you cut through some of the red tape. And so those are the kinds of practical things we work on. One of our projects focuses on child malnutrition. These are early intervention
centers. Each village has one or two of these, and it's basically focused on children 0 to 5. It's a nutrition program. They're supposed to be screened for malnutrition through growth monitoring, height and weight measurements. There's a lot of things that they could be doing, but for lack of some resources and training, so we're working on those issues. This is an Anganwari worker. Here's some more pictures of an Anganwari. And we've also done some research and moving into a larger epidemiological study on social determinants of mental health in regards to some gender disadvantages. Punjab, despite economically being quite a bit better off than much of India, still struggles a great deal with gender equity, and there's evidence that it does have a negative impact on health. We're looking specifically at mental health. But we also found through our initial assessment, we did a demographic and health survey, we found that in just the 9 villages where we work, the under 6 sex ratio is very skewed. So only if you look at the ratio, only 786 females are born per 1,000 males. So of course it should be just about equal, but the preference to have a son is so strong that often females are selected out of the population prior to birth through sex selection. But this is kind of the downstream problem. There's a lot of upstream problems, like looking at gender disadvantages, equality issues, and as it relates to health that we can work on. And I also mentioned that this is a team environment and a supportive environment. Here's a group of our students in the midst of a qualitative focus group with female youth. This is outside of a middle school with our team that was working on the gender equity project. We started out looking at why teenage girls are dropping out of school, leading to the discovery of some of these really strong gender norms. So these are some of the teachers in our team there. And before I talk about excursions, I also wanted to let you know that much of our student work has turned into poster presentations, conference presentations, and sooner or later we're going to have quite a few publications too. Those are all in the works as well for peer-reviewed journals. We work really hard in the field. It's very hot in the summer. It's the only time we can really go for the length of time that we need to be there given the academic calendar. But it's so worth it. We work really hard, but we also play really hard. We get up into the cooler mountains for a weekend just to kind of debrief and relax and take in the tranquility of the mountains. Buddhist culture, we do a lot of, you'll get to see a variety of transportation mechanisms. There's some transportation marvels in India. One of our favorite games is counting up how many modes of transportation you see in a day. Anywhere from ox cart, elephant, van, bus, train, rickshaw, what have you. It's a really great experience. I just want to, as a take-home message, I just want to say we work really hard, but it's for a really good reason. You'll get a lot out of it. And if you have any questions, about 14, in terms of itinerary, about 14 days are field work, about 5 days are excursion, and the other days are travel days. It takes a long time to get to India, so our trip's a little bit longer. So, thank you.
Questions for Sharon? All right.
Oh, yeah, actually, yes, I did have one, sorry. So this is actually really for all of the programs, but we've talked about how the research continues and you work on publications afterward. I'm just wondering where that all takes place, if we continue as a group, or if we're just meeting individually people to.
I can speak for India's program. The way that works is typically on your own initiative as a student to stay in contact and stay involved. It's not mandatory. Oftentimes when you get back from a trip, you're exhausted and it's hard to get back into it, and we understand that. But if you want to be there and you show up and stay involved with the faculty and the team, we are always open to that. We need many hands to do this.
And I'll say in Ghana, I mean, the papers that we've had come out have been co-authored by our Ghanaian students and our American students, and so a lot of that takes place electronically after the fact, and so we'll take 2 or 3 months, everybody gets home, back into school, and then over the course of the next 6 months, works on the final results of dissemination, the data interpretation, and then it takes place electronically. Other questions? All right, I will quickly go to our next, Peru. Okay, so Peru 2015. Again, myself and Dr. Harry Rosado was one of our HIV ID docs. There are actually 2 programs in Peru. If you're a medical student, there's a medical student spring break, which is the end of the first week in March. If you're interested, Dr. Rosado and I take medical students down there to do some clinical work, generally revolving around HIV, infectious disease issues, because they do have plague still existing coming out of the sugarcane fields in Peru. But if you have a different area of interest, we certainly can arrange rotations for medical students to go with us to Peru during that week and do gastroenterology, cardiology, whatever you're interested in. But we generally try to take a group of students over the medical student spring break to Peru. Our public health program takes place June into the beginning of July. We're combined down there with the University of Cesar Vallejo, who is a famous Nobel laureate author out of the Peruvian region. We work in the area of Trujillo, which is on the north coast. Another name for Trujillo is the city of eternal spring. And so it's 70 degrees, sunny. In fact, just north of Trujillo is Huanchaco, the surfing capital of South America. But you have a little time to surf. So why 2 groups? One, we do the clinical, and then we do a public health intervention, a public health program later. In spring, like I said, it's primarily medical students. In the summer, it's community-based research partners. We work in an area called Victor Larco, which is an industrial area on the suburbs of Trujillo. Trujillo is a modern city with shopping malls and Radio Shack and Pizza Hut. And yet at the same time, you have on the periphery communities that still don't have running water, that still dealing with their on-site waste. And so you have this interface of, on the one hand, communicable diseases like typhoid and leishmaniasis still happening in communities, and just blocks away you have non-communicable diseases like hypertension and high cholesterol, diabetes. And so you have this interface of the 2 worlds, both the communicable and the non-communicable diseases, overlapping in their area, interfacing. And so you have this unique opportunity to study and to evaluate and to work on both impoverished and rich populations and how they share disease back and forth. We always take some time to, much like everywhere else, spend a little bit of time at the beach. We spend some time understanding, learning the different levels of the healthcare system within Peru. They have a Ministry of Health system for those who have no care. They have a Social Security system for those who are employed. They have separate hospitals for military and police, and they have private hospitals. So we spend some time visiting through to familiarize ourselves with the different levels of care and what opportunities are available in addition to performing our research. And then getting out into the communities. Now, like everywhere else, we spend a little bit, we take the last few days, we work very hard initially, and then travel and spend the last few days going to Cusco, down through the Sacred Valley, ending at Machu Picchu for our spiritual experience, and then coming home. So, Mozzie, anything to say about Peru?
Try the guinea pig while you're down there.
The cuy is fantastic. All right. Now, I'm going to stop there for a minute, and we have Katrina from the Learning Abroad office, who has a little bit of information for you. And am I right in that it is, this is your, So this is Katrina, the representative from the Learning Abroad office that covers the global public health programs. And so if you have questions, Katrina is the Learning Abroad guru that can answer them all.
So just a few basic things here. We want to just remind you of the application deadline. On our end, that's of course very important since we're doing all the administrative stuff. So please apply by February 27th for these summer programs. And there is a $100 late fee if you do not make it by that date, so please apply on time. And you might have noticed if you were looking into what's required for an application, there is a session called Learning Abroad 101 that you have to do. But we have some good news. It has now been converted into a Canvas course, so you can do it on your own time. It's going to be opening starting this Thursday. Otherwise, you can also come and attend a session in person. It's about an hour, and that's done usually in the Union building 3 times a week. And you can go to our website and find out all about the times that's offered. That will fulfill the requirement. You can ask any questions, speak to a peer advisor who knows all sorts of things about the process too. Question?
Is the requirement before you apply, or?
This is as part of your application. So your application won't be considered complete until you've done that. So it's usually better to do that first, but you can do it in any order. It just won't be considered complete until that's done. Okay. And then we do offer scholarships through our office as well, and you'd be eligible for those, as well as anything that might be offered through Global Public Health. And our application deadline is February 15th. So we have one of them that's called Student Fee. That one you basically just have to say, click, yes, I want to do it. It's a lottery-based system. It's very easy. We have a social media scholarship that you could do if you are into blogging, Instagram, Twitter, things like that. We also have a diversity scholarship and a merit-based scholarship. And there's all sorts of information on our website about that. So learningabroad.utah.edu. And the only thing to note about these is that diversity and merit are going to be via Google Forms, so you won't be able to apply through your application. These ones you will, but when you go into the scholarships tab of your application, you'll see that information. You just click the description, and then it'll provide you with a link for that. And then I did want to mention as well that we have our Study Abroad Fair coming up on February 3rd. That's in the Union Ballroom from 11 to 2. There's some flyers like this out there, I believe, and some flyers about the programs as well that we printed off. And we would like you, if there are return students among us, to present a poster session. So I think right now we only have 1 submission. We would love to have many more. So the deadline was today, but we are certainly welcoming them late if you're a little bit behind the game. All you have to do is fill out our form online. It's pretty easy. You'll be able to find that on our website as well. And then just come and present. Also, we have our Global U Expo on October 7th. So if you do participate on one of these programs and then you've done research and want to present it then, that is also an option. So stay tuned for that. I think that's about all. Any other questions? Yeah.
So the application includes a $500 down payment, correct?
Yes.
So the dollar amount that's on the page, for instance, for Ghana is $41.50 or something like that. The $500 is included in that number, not in addition to that number, correct?
Right.
Correct.
Yes.
Okay. Debbie's confused, Katie. Okay.
Yeah.
If you've done the Learning Abroad previously with another Learning Abroad program, you don't need to do that again, right? This 101 class?
Correct. Yep. If we have it on record that you've done the Learning Abroad 101 session before, then you don't have to do it again. So it'll be the same thing anyway.
And just one other point. So because we have, the Learning Abroad has actually carved out a very special deal with the University of Utah. And so you're able to go on any of our experiences and receive 4 credit hours for the expense of the program. You don't have to pay, you don't pay tuition on top of the expense of the program. In exchange for paying for the program fees, you actually receive 4 credit hours towards your degree. Dr. Dickerson, in addition, the second block of spring semester offers a class, is it 1 credit hour?
It is.
That is specially designed to train individuals who are going on learning abroad in the proper techniques, practices of participating in global health research. So if you want to take a learning abroad, if you want to take a leadership role in learning abroad or want to sharpen your skills in global health research, the class that Dr. Ty Dickerson offers, the second block of spring for a credit, is absolutely recommended.
You can look at that by clicking on our website here, Global Health Service and Learning Preparation course. That opens up a PDF describing, and it also has the course numbers. Great. Makes it very easy to register for it.
Are they different course numbers for undergraduates and graduate students?
Yes.
Yes.
Oops.
And all of the flyers and everything are on tables out here in front, so as you're leaving, feel free to pick up flyers and more information about any program you're interested in.
Yeah,
All
I'll
right.
stick around if you have any questions for me.
Yes.
You'd ask.
You're going to stick around because you're the unbiased one. I have here, hopefully everybody's submitted email. We'll now have the drawing. Is anybody missing? Oh, okay. All right, Katrina, since you are the unbiased observer, the prize is a $500 scholarship towards any of the global health learning abroad opportunities.
Dig deep. Okay. Rachel.
Oh, that's me.
I don't have anything to give you. I just hold on to this, and when you apply, just remind me, and we apply, we give you a $500 scholarship towards the program of your choice in the Global Health Public Health. Great. All right, thank you for coming. Any questions? Come see the display.